committee meeting to order. We'll start off with attendance. Rebecca, could you call the roll?
Sure, Mr. Chairman. Ray Joyce,
Present.
McLaughlin,
Here.
Feston, and Petto are excused this evening. Miller,
Present.
Robinson,
Here.
Ward,
Here.
Collins,
Here.
and Lockhart. You have a quorum.
Thank you, Rebecca. Under previous business, can I get a motion to approve the previous meeting minutes? Motion made by Mr. Miller, second by Mr. Ward. All in favor?
Aye.
Any opposed? Unanimous. I am going to move under previous business number 2 to the end, just so we can get Commissioner Miller and Dr. Giordano out of here sooner. So I'm going to move on to current business. I understand number 3 and 4 were motioned or tabled by the sponsor. Is that correct?
Yes.
Okay. We'll move on to number 5 and 6 with the Department of Health. Number 5, amending resolution number 184 for 2019 regarding the tuberculosis prevention and control program. Tonight we have a new commissioner. How are you tonight?
Hello.
And Mr. Ransom Moore.
Yes, thank you. So my name is Dr. Simmons. Pleased to meet everyone. Thank you for coming. I'd like to bring the...
Actually, and welcome aboard. I haven't had a chance to meet you yet, so maybe we can do a little just for the health committee. Ray Joyce, county legislator from the 13th. Mr. Miller, you want?
I'm over at 36, but that couple times.
Sean Ward, we met.
Carolyn McLaughlin, we've met District 1.
Mark Robinson, 4.
Patty Lockhart, District 26.
Zach Collins, 37th.
So, thank you. Sorry about that. I just wanted to make sure you
Thank you.
proper introduction.
And Iman Simmons, I'm the new Deputy Commissioner of the Health Department. So we're bringing to the table that the Albany County Department of Health will be asking for your approval for the Tuberculosis Prevention and Control Program to receive an additional $30,000 in grant funding for a 9-month extension to December 31st, 2024. This additional funding is approximately 75% of our annual budget. The program includes early case detection and reporting, prompt diagnosis, for which last quarter we did 13 T-spots. Appropriate treatment for latent TB. Last quarter we did 50 cases. Case management for direct observed therapy, or DOT, for which we have 7 active cases. Active cases stay on with us for 6 months, greater than a year. Aggressive intervention and aggressive investigation contacts. And this is a mandatory service for a health department. It's paid for by Article 6 as well, and we are required to do this. So we're requesting authorization to accept additional funds.
Thank you. Do we have any questions from the committee? Hearing none, can we get a question?
No motion.
Okay, motion from Mr. Miller, second by Mr. Ward. All in favor?
Aye.
Any opposed? Thank you. Number 6, authorizing the submission of a grant application to the New York State Governor's Traffic Safety Committee regarding the General Highway Safety Grant Program.
Correct. So as you may be aware, Healthy People 2030, one of the objectives is to improve pedestrian safety. Injury and prevention is a Article 6 funded program. It's a core health public service. In Albany County, there were more than 807 pedestrians struck by vehicles in a 4-year period. Majority of those injuries occurred in the city of Albany and on major intersections such as Madison Avenue, Quail, Central Avenue, and Henry Johnson Boulevard. Our core victims are between ages of 21 to 29. That represents 29% of pedestrians struck. These crashes are expensive. The Highway Patrol estimates that they're from $11,000 to about 100 times that in the event of a fatality. So we have submitted, we would like to submit a grant that continues our funding for the safety committee program. It's $35,000 in order to continue the work of improving pedestrian safety, and that's what we're here for.
Thank you. 100% state funded. So do we have any questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Miller, seconded by Mr. Collins. All in favor?
Aye.
Any opposed? Thank you.
Thank you.
Next, we'll move on to the Department of Mental Health. Number 7, authorizing an agreement with Addiction Care Centers of Albany regarding opioid settlement funding and amending the 2024 Department of Mental Health budget. Mr. Giordano, welcome.
Thank you very much. Good evening, Mr. Chairman. Hi, everyone. Got a whole bunch of stuff to talk to you about tonight. As you may recall, I was here in front of this committee last year to talk about the opiate settlement fund and the awards that would be coming to the county of Albany over the next possibly 15 years. We've received the first 2 allotments of those funds. These are the result of litigation around the country with pharmaceutical companies. All the money that we're going to be talking about is been allocated to Albany County. Every county has gotten a share of these funds. A few months ago, we put out an RFP. We followed all of the county procurement procedures. We invited our community providers to submit innovative proposals to address the opiate crisis that we're facing. And we have had a multi-level review process, and we've identified 14 proposals that I'm going to talk to you about this evening as worthy of the first year's awarding of funds. So that's basically just a kind of a context around this, but I think these are, you want to hear about each one of them separately?
So if the committee notices, we have programs, items 7 through 20, which are all opioid settlement money for separate programs. Maybe we can go through it, and if anybody has any questions specific to a specific program. It looks like Carolyn, do you have a question?
I just have a general question, not specific
Go ahead.
program. In terms of, you said this was over, these funds will be given out over the next 16 years?
Well, 2 have already been counted, so it's like 14 or 15.
14 more years? Now, I just want to be clear that these authorizations that you're giving now, these aren't the only ones that will be getting funds
Oh,
over the
no.
next 14 years.
No, we hope
This
to-
is just the first year
First
that
2
they are the
years.
ones who have been, who have responded to the RFP.
Yes, ma'am.
And going forward, next year there will be another RFP.
Well, so next year there will be more money. We don't know how much until
It
the
comes.
state goes through their equations, and they base it on opiate mortality, suicide, and poverty. And those numbers shouldn't change that much year to year, but we don't know the final number until they award it to us.
But there will be another, I mean, I noticed that
There will be
these,
multiple opportunities.
For people to-
Absolutely,
Right.
yeah.
and these, they can apply again.
Folks who have already received awards can apply again.
Okay,
sure.
but you will be, but I guess more importantly for me is that others will have the opportunity.
Absolutely, absolutely.
Okay. Thank you.
Yeah, we're looking forward to this being the beginning, not the end.
Okay. Thank you. Thank you, Mr. Chairman.
I have a question too.
Go
Do you have a
ahead.
question? So, all these, to look at them all in one group, are these all groups that you guys have worked with before? We know about them,
Yeah.
confident in them?
Fortunately, all of the programs that I'm going to talk to you about this evening are agencies that we either have current relationships with or whose reputation is known to us, and we work with them in some sort of partnership. And you'll recognize, I think, most
I
of them.
recognize most of them, yes.
You'll recognize
Just wanted
most.
to make sure they all were that way.
I understand.
Okay, thank you.
Do we
Mr. Chairman.
have any other questions, general questions about the settlement money? Go ahead. Patty.
You mentioned 14 years.
Yeah.
So that's the whole period for all these to be given out?
Yeah, there's money coming out directly from OASIS and the
Right.
Department of Health through their own RFP process, and that'll extend over the same period. But counties are getting their own allotments. Each of those, it was 16 years in total, 2 have already kind of passed us.
Okay, that's the 60, okay.
Yeah, it's kind of remarkable, but there's a lot of money at play, and the way I understand it is the corporations that were litigated were able to decide whether to pay out their penalties in one lump sum or spread it out to keep their companies alive. So the longest extension is about 16 years, and we think that the money's going to decrease as the years go on.
So that's why they can keep Renewing isn't getting it over.
Yeah, because there was billions of dollars nationwide that have come from these settlements. And some of the cases are still in litigation,
Yeah.
like Purdue Pharma.
Yeah.
Still hasn't been resolved.
Thank you.
Mr. Ward?
Yeah, I noticed that there's a couple of repeat, a couple of the providers got 2 awards. Did they
Well,
submit twice? or-
Yes,
Okay.
we encourage them, much like, the question Dr. McLaughlin asked was, can they apply again? We encourage people to give us your best shot, that, if you want to submit 2 applications, we'll review 2. If they meet the criteria for what the money's designed for, we would we would look at them. And yes, at least 2, Albany Med and Colony EMS,
Colony
both
EMS.
submitted 2.
And I see one of them was to retain staff, and the other one was training, in
There's
the
2
EMS anyway.
There was 2 separate ones that they did.
And they submitted twice for 2
Two separate
programs.
responses,
Okay,
full responses to the proposal.
very good.
Councilwoman, question?
Go ahead, Mr. McLaughlin.
When did this RFP go out? Because I don't recall
I don't know.
seeing it.
It was, it was this year. And we announced it to the public through our opiate task force, and it went through the procurement process we had through advertising.
Oh, I'm sure it did, and it slipped my mind.
Yeah.
I don't know if anybody else knew about it. But, so, as far as the future,
Yes.
would they be coming out at the same time, or is it depending on how the state moves and how awards are given? So
Yeah.
it could happen at any time.
I think it's going to be more the latter. This is our first run-through, and, we're depending on the state to keep their word about giving us money every year. I'd like to think that we could get on a cycle.
I just want to ask that, that there be more transparency in terms of the RFP, and at least legislators know clearly that it's out there, so that we might have some organizations that we would like to encourage to apply for some of the
Understood.
funding. Because there is the great need to address the opioid impact around the county.
Yes, absolutely right. And I understand your point, and we'll make sure that that happens. I will say that we use all of our community service boards and our treatment provider groups and all of our interactions with our community partners. So it did penetrate, but we will certainly add you to the list.
Thank you so much.
Thank you, Carolyn. Do we have any other general questions about items 7 through 20? What I would like to do is ask that we group 7 through 20 and pass them. But before we do, does anybody have any questions about each individual program? You have Addiction Care Services of Albany, Second Chance Opportunities, Healthy Capital Region, Albany Medical Center, Catholic Charities, Colony EMS, Community Pharmacy, Hive of Hope, great program in Central Avenue, Interfaith Partnership, Senior Hope Counseling, Albany College of Pharmacy, and Gem Drug, also known as Lincoln Pharmacy, which we're all aware of. Anybody have any specific questions about any one of those individually before we group them? Hearing none, can I get a motion to group items 7 through 20? Motion made by Mr. Miller, second by Mr. Ward. All in favor?
Aye.
Can I get a motion to pass items 7 through 20? Motion made by Mr. Miller, second by Patty Lockhart. All in favor? Any opposed? Thank you, Dr.
Mr.
Giordano.
Chairman, may I say one thing? I'm very grateful that you have received it in this manner. I believe that this is a wave of really positive impact for our community. And, you know that, some of you may know I serve on the state committee for the governor on opiate task force. And there's just so much tragedy across the state and so much suffering. It felt good to be part of getting some money out on the street to help this, so I appreciate you all trusting us to do that.
Well, we do, and we appreciate everything you're doing in your group. It's, we've had conversations about this and the impact it's had on everybody knows somebody that's impacted by this, so thank you for all your work.
Thank you very much, all of you.
Thank you.
Take that.
So we can't dismiss yet, we still have item number 2 on the agenda. Back to previous business. Number 2, the local law number A for 2024, local law of the County of Albany, New York, amending Chapter 106 of the Albany County Code, setting forth the requirements for facilities within Albany County where the local governmental unit identified by New York State as the Albany County Department of Mental Health. And I believe this was the local law introduced by Ally McLean Lane, and I think Sean is going to speak on it tonight for any questions that anybody had specific to this. This is the locations of our treatment program. So I think everybody's well aware of the local law. Does anybody have any questions for Mr. Ward?
I don't have questions, I definitely have a comment.
Go ahead.
So just, you know, in general, I'm opposed to this, unfortunately. It's an uncomfortable situation. If anybody remembers back when this started, I was one of the original sponsors.
Yeah.
But, you know, we heard from the mental health providers about the impact it would have on them. And, you know, one of the things that in my conversation with Ally as we went along, for those that have not forgotten or not heard this, the New York State mental health law already allows for the ability for the designated local governmental agency to notify whomever needs to be notified, to hold public hearings, whatever the case may be. Unfortunately, it hasn't been happening. So it's my opinion that we shouldn't be making a law to tell our own departments that they should be doing their job. And instead, we should be communicating with those departments, writing a letter, whatever it may be, and letting them know, hey, you've let us down on this, and this is what our expectations are going forward. So for that reason, I won't be supporting it. And I just wanted to make sure I had that comment out there. Again, the providers were against it, and again, I think it's superfluous for us to make a law to tell our own departments to do what they should be doing.
Do you have any other questions for Mr. Ward from the committee? Hearing none, do we have one for Mr. Bergdorf?
Yes, I just want to highlight a discussion that we had last night in law, which ended up with 2 of us voting in the negative and some sympathy among the other members of the committee. If we put this law into effect, you know, people call it a notification bill. I call it a disnotification bill. Because if this law goes into effect with your exemption, that people can move anywhere in the municipality without there being any notice, which is what this bill says right now. Somebody could move Camino Nuevo to Carolyn's district, and you would never be notified, because we have carved out anyone who is licensed by OMH right now within the city, within the county, and I believe there are 28 in the city of Albany, and there are 4 or 5 within Latham and Colony. Those people in my town, they could move from Central Avenue to Route 7, from Frank Moriello's district to Susan Warlord's district, and there wouldn't be any notification. So this is not a notification bill. It's a get out of jail free card. They're, by caving in to support Camino Nuevo's move anywhere in the city of Albany, and that's why this language was drafted. They are opening up the ability for any one of these licensed facilities to move within a municipality without notification. So I'm not supporting it for that reason, because I believe if notification is good for somebody coming in out of state and moving into my district, it should be as good as if one of the people in the town of Colony moved into my district. So I'm not supporting it, and Jennifer and I voted against it in law last night for that very reason, and I'll be asking people on the floor and in my conference to oppose it as well.
Thank you, Mr. Bergdorf.
Excuse me, I know.
Mr. Robinson, go ahead.
You know, after hearing my colleagues speak, it's time and time in the past is a conversation within my community that when it comes to drug treatment, it seems like they pick the poor zip code for location. okay? And this is why we have the situation right now with Labable. And if this law is saying that any entity can just say, hey, we want to move here without no notification, you know, I guess the red flag that historically, it seems like these type of facilities always find themselves in poor zip codes. So, I mean, you know, like I say, right now I'm in, you know what I'm saying, I'm in limbo as far as, you know, why wouldn't, you know, it be a responsibility for it to be, you know what I'm saying, a notification of a move of a particular, you know what I'm saying, drug treatment center or anything, you know what I'm saying, dealing with mental illness without that municipality or that legislative district, you know what I'm saying, being aware of that move. So maybe, Mr. Ward, you can expound on that comment?
Well, I agree with everybody who's said here today. But this bill has come a long way since it was first put on paper. There's been a lot of negotiation, a lot of conversation, a lot of changes to it. And I am not the lead sponsor, but Ms. McLean Lane asked if I would carry it because I am in favor of notification. If somebody is going to locate a facility in my legislative district, doesn't mean I'm against it, but I should know about it. And it should go for, and I also worked in the mayor's office for 40 years, and I couldn't imagine the commissioner of health or mental health or one of our agencies signing off on a facility that we didn't know about. It shouldn't happen. So I definitely agree with the content of this bill, but I don't disagree with some of the comments that all of you have made tonight. And, you know, I guess, I don't know what the chair's preference is, whether he'd like to table it, or, I thought the discussion was that we were gonna send it without recommendation.
Yeah, so I think Paul has another question, but
Okay.
our job isn't the location of these facilities. Our job is caring, as a health committee, I should say, our job, caring for those most in need and those that are struggling with opioid addiction and making sure they get the treatment they need. As we saw with the relocation of Camino Nuevo, we all got letters, you know, we realized through Camino Nuevo that a retail district isn't probably the best place for these locations. Residential neighborhoods probably isn't the best location for these. We found an office park with 3 or 4 other offices out there. We thought maybe that's a great location. Well, guess what? According to them, it wasn't a great location either. So I do have some concerns sharing. You know, I do want to be notified. I think that information is important, but it's important though that we can't, you know, I just don't know a location in Albany County where we'd say we want to put one of these in this building and not have people come out and say we're totally opposed. I think our focus as a health committee should really be focused on the treatment of those that need it the most. Our opioid deaths increased by 17% from 2022. I'm sorry. From this time 2023 into 2024, it's a problem, and we need to have these facilities. So I think this would be a hindrance, this bill. So my suggestion for the health committee was that we send it out without recommendation, wearing the cap of of a committee that says we want to make sure these people that need these services get them.
I don't think as somebody who is in favor of this bill, Ray, I am 100% in favor of treatment facilities.
No, I know, I believe
that
it,
is
yeah.
not the object here.
Yep.
The object here is to, that I should be notified if they're looking to locate
Yeah,
one,
yep, but-
so that I could be at the
Yep.
table and,
Yep.
and maybe put it in the right place, or
There-
help put it in the right place, along with local officials that do that for a business.
Right, but you know, there's some communities where if we were to move one of these facilities outside of Albany, you know, into a suburb, there'd be a lot more pushback from that community, because as we've seen with Camino Nuevo, right? To Mr. Robinson's point, they could be relocated right in Albany. I mean, it's just, there's problems, I think, structurally with the local law itself. You know, and I was with Mr. Miller, I was initially in favor of it, but I'm just afraid that wherever we try and cite these, there's gonna be community pushback.
Well, there's been, you know, there's been other treatment facilities where there was no pushback.
But not while
And
this
they
local
went-
law is in effect, though.
Pardon?
But not while this local law is in effect.
This local law is in effect now, so,
Well, what I'm saying is, you know, Camino Nuevo was cited without any community input.
yeah.
Yeah.
Well, I don't believe that should happen, is what I'm saying.
I agree.
So, I don't wanna get circular, but I just
Yep.
wanna come back to what Sean was saying, reiterate what I said. The present law in the state allows for notification. We just didn't do it, okay? And I know we left, but I would call it out to Dr. Yano. It has to come from our own Department of Mental Health, right? They need to do that. That's already in the law for them to do that. So I'm against a law telling our departments what they have to do. They should just be doing it, and we should do that through a letter, so, again,
And
I'm gonna reiterate.
And I said, I don't
Yeah,
disagree
just-
with
I
what
know,
you're
I'm not
saying.
yelling, I'm not
I'm not a
arguing.
big, let's pass a local law for everything.
correct.
But in this case, there was definitely an issue
There was.
with notification, and
Him and Ann
the
as well.
sponsor, Ms. McLean Wade, has put in a law that's gonna make sure that there is notification. That's, you know, whether I feel that we need a local law or not is beside the point. But I do believe we should have notification. This will ensure that that happens.
Any other questions from the committee? Mr. Bergdorf?
Oh, I'm sorry, you want to?
Oh,
I just want to follow up on something that you said, and I think someone else said over here, that this is actually would prevent the notification. And
Relocate.
that concerns me. If that's, I certainly would want to know. And and I have not found justification for not letting me know in this bill. So, for that reason, I cannot give my full support to it, because if you're telling me something is coming on Second Avenue or Delaware Avenue, South Pearl Street, and I don't know about it until it's there, that's not gonna work for me.
Mr. Robinson?
No, she was,
Patty, I'm sorry, I didn't see your hand.
That's okay. Question for my colleague, with the state law that you referred to, does that,
It doesn't require them.
no,
Okay.
but it, does it require specifically legislators of the legislative district?
No, so it doesn't require anything. It designates, I forget, mental health law 32, is it? Yeah. It designates a local governmental agency to be the responsible. So OASIS has to have that designated local government agency, which is, in this case, our mental health department. And then
Then the mental health
it's their
department.
responsibility to hold a public hearing, to notify people, whatever. But it's not in law that they have to do that. How they handle it is up to them.
And the mental health department doesn't necessarily have to notify the legislator?
Doesn't have to,
It-
yeah.
It's more other entities?
It doesn't have to know, under the mental health law of New York State, because I read, Ally
No, I
had me
mean
read
the
it.
when it gets to the mental health.
Yeah, when it gets to mental health, all it says is they then become the agency to decide what to do next. It doesn't prescribe them to do anything.
Okay, thank you.
Mr. Robinson?
yeah, and again, I totally agree with you, Mr. Chair, as far as, treatment and, and what's, currently, our state of, urgency to, to really get help where help is needed. But, if we look, and I'm just, with no statistics, with no data, I'm just saying that the majority of these treatment centers, I believe, is in low minority districts, zip codes. If we take account on where these particular centers are located presently, like I say, I don't have data, but I can, I would just say that they are definitely in poor districts. And, it could be a combination of reasons why, low voter turnout, low response to people that's gonna say, not in my backyard, not, really the proper notification, that certain treatment centers is coming. So, it does draw concern. And, I just think that, maybe amendment to the bill or, more dialogue and just try to push it, in its present form, maybe conversation.
Well, I think it'll determine everybody's vote on the floor and how it's currently written. I have issues with it, but any other questions from the committee? Mr. Bergdorf?
It's unfortunate that Ally wasn't at law last night and she's not here. We have surrogate folks who are, speaking for her and nobody can make any decisions. But we asked last night whether we could just take that line C out. So there's notification, there's everything, but there's no exception. Anytime one of these folks moves or moves in, we get notified. That's a very simple fix, is take C out of the law. And I can support that otherwise, but it doesn't set up a two-tiered system where you have
You can't
34
justify
people
that.
who can move within their municipalities without any notice. And that's, I would hope that people would consider that as a possibility as this goes forward to the floor.
Yeah, I can't.
Thank you, Paul.
That's why I'm saying, should we,
We can table, or
really
she
table,
can,
we want
Too much.
Yeah, I would, as the or the surrogate, I've never been called a surrogate before. As the surrogate, I'm listening to all the comments here, and I really don't, this is somebody else's bill. I do not want to make a motion to remove it, so I'm gonna request that we table this, and we'll come back and, we'll have the sponsor address this with legal and share your concerns to her.
and before we, so we have a motion to table, but before we do, it looks like with Mr. Dennis,
Yeah, I
Feeney,
just
do you have a
spoke
question?
with Allison, and she's amenable to removing that language.
Well, she have to do it, or?
Notification would not be, everybody would get notification, you can introduce balloons.
Even
So,
if it moves within municipalities?
yep,
So we're just gonna strike line C?
gonna strike it.
Okay.
So everybody gets it.
I think that's
Everybody gets it.
that'll help in this discussion, not gonna help
Okay.
Mr. Miller.
And I'm on, she designated me as one of the prime sponsors last night.
No, sir.
I don't-
Still,
So-
I was about to make a
He's the primary
Yeah,
surrogate last
I
night.
mean,
I'm the surrogate.
Passing it around.
Allison is,
If Allison is saying we can do that, we can do that, and then we'll just have to have a post-public forum of law.
Yeah.
because that's a major change.
It's not a
Yeah.
major change, well, I mean, it might be, but the language is not the same, coming out of two separate.
Sure.
Okay.
Okay. So do we want to make an amendment?
Yep, you can,
I think everybody else.
All right,
You can make a
as,
motion.
Or do we table it and then do it?
There's no need to table it.
Oh, okay.
I have never been so indecisive my whole life here, 29 years here. But I'm gonna remove my motion to table, because I think I can. And I'm gonna make an amendment, which I don't think, does it have to be in writing, or can I just strike it out here?
Yeah, we're just striking.
So
We're gonna strike section C,
Of both sections, no, section
from
3
section 4, subsection C,
and section 3, subsection C.
and section 3, subsection C.
Yes.
Ray, I have a question for the council.
Don't mess me up, Gary, I'm on a roll
Well,
here.
just make sure we don't want to miss
I
anything.
just
Gary.
I'm only
want to make
kidding.
sure you're correct in your role,
No, I
that's
know.
all.
I know.
Is that
Thank
a
you.
substantial change?
No, it would not be a substantial change, especially since it's removing the language.
Okay.
I just, yeah.
What it does is prevents location to relocate in a municipality without notifying,
If council says it's not a substantial change would trigger another public hearing.
Yeah.
Correct.
And so I'm fully confident in whatever council says.
That's what I asked her before I thought that.
all right.
So the
now-
amendment, I'm making the motion that we amend it, we do need a motion on it, I believe, Mr. Chair. So I'll make the motion, we need a second to vote, I guess, right?
Just so everybody's clear, it's section 3, paragraph C, section 4, paragraph C are being struck by the sponsor, Ally McLean Lane.
I was designated as one of the prime sponsors last night, so.
Okay. And this will have to require a post-public,
Forum of law.
yeah,
Law.
law committee will have to revisit it because they did not strike those paragraphs from the local law. Did you have a question, Patty?
Yeah, Counselor and Chairman, just so I'm clear in my head for all this discussion, what we're doing by removing that is, so within a municipality, use Colony, for example, if it's my district and somebody's moving to another district within Colony, they have to be notified, right? Before it was, you could just move around all Colony.
Yes. Within, it was intra-municipal.
Right, okay. So I haven't,
Yep.
right, okay, thank you.
And for the Albany folks, that means that Camino Nuevo may have some real issues if they were trying to
Exactly,
relocate.
but that also addresses Mr. Robinson's issue of
Yep.
just everything getting dumped. I mean,
Yeah.
this is an issue, I don't know how it's gonna pan out, but it needs to be dealt with,
Yep.
because
And again, I'm gonna
we all
reiterate
have the
that,
same concerns.
Yeah. Mr. Robinson, do you have a question?
No, it was totally, I mean, I totally agree with my colleagues. And like I say, I don't have the data, but I know that I'm 100% correct, in my assumptions about, poor zip codes and how historically that these type of treatment centers is already being dumped in, these communities.
You're absolutely right, Mr. Robinson. What's that? Well, a second on the motion to restrike that, okay, yep, so can we get a second on the motion to rewrite the local law, second by Ms. Lockhart? All in favor on the rewrite?
Aye.
Now, before we vote on it, I would again like to reiterate, as a health committee, we should be focused on care of these folks that need this help the most. Opioid addiction is a real serious issue. Trying to cite these locations is difficult. And I think the health committee should really take the position of no recommendation. We can just move it out and let the members choose. I would like to get a motion to send it out without recommendation.
I'll make that motion.
Second.
Motion made by Ms. Lockhart, second by Ms. McLaughlin. All in favor?
Aye.
Any opposed?
Did you all agree on the amendment? That's-
Well, because I think the reason I did, Gary, just so you know, is because I think the whole body needs to.
Yeah, but when you make a recommendation, you make a change and that everybody agrees with, it should go out
Oh, just
favorably.
us agree with it.
Yeah, that you agree with, yeah.
It's
I
a
mean, the
different,
committee's one
I was gonna
maybe
send it on
not-
negative.
it's a different issue we didn't talk about, Gary. It's a different issue.
I mean, I just
Care
find-
versus
I
location.
find it odd,
Negative
that's all.
recommendation.
Motion to adjourn?
It's not what-
Motion to adjourn.
It's going out.
All in
Second.
favor?
Aye.
Opposed? Unanimous. We're overdue.